Okay. And I'm going to start again, if you don't mind, because I want this entire interview recorded. I'm Marianne Waldman from Teach My Kid to Read, and I am really honored to introduce Dr. Todd Porter, who will be interviewed by Faith Borkowsky tonight for Facts Tell, Stories Sell. Dr. Todd Porter is a community pediatrician in Denver, Colorado. He received his medical degree from the University of Virginia and completed both a pediatric residency and preventive medicine residency at the University of Colorado, where he also received a master's of science in public health. Dr. Porter has practiced primary care pediatrics for the past 13 years, with the last 5 years spent in a federally qualified healthcare center where he cares primarily for low-income children of color. Over his career, he has had the fortune of working with mentors who have educated him on the struggling reader and the effects of school failure on the child's mental health and physical health. Yet his greatest teacher has been his now 11-year-old daughter with dyslexia, who continues to inspire, enlighten, and transform his role as a pediatrician and parent advocate for all of our struggling readers. And this is really an amazing opportunity for all of us, because so many times we say we really want to get the pediatricians involved in understanding more about dyslexia, how we read, and how they can get involved, but we don't often say how. And you have lots of ideas. You just published an article that came out in Contemporary Pediatrics. Faith Borkowsky has it up on High Five Literacy and posted in all of the sites, so people can read the article after the interview if they haven't read it already. And tonight, just listen to your story and some of your just wonderful ideas about how we can start circling the pediatricians into this discussion. So I'll leave it to our literacy expert, award-winning author, and just literacy superpower, Faith Borkowsky.
Thank you, Marian. I'm so happy to be here tonight. This is a real treat. And as I said to you, Dr. Porter, so many people are interested in hearing you tonight. It's a unique opportunity to have a pediatrician with a child who has dyslexia. So I think that's where we'll begin. Let's just hear a little bit about how you discovered that your child had dyslexia.
Yes, well, and thank you for this opportunity. I mean, really the honor is mine. I mean, I guess, speaking first as a parent, we have 3 kids now, and our oldest is in 5th grade and she's now 11. And I think, like probably every other parent, we put her in school, and we just kind of expect that everything will be fine, and that the school will teach her the things that she needs to learn. And so there was a lot of trust, I think, from my wife and I's standpoint. And we went to a school that was rated like probably best in the area. We lotteried, and so we were we were very, I guess, optimistic and hopeful for her future as a learner. Kindergarten went by, and our school did this kind of assessment called Dibbles that I didn't really know what that was at the time. And we didn't really get any feedback for how she was doing. And then I remember at one point, and we must have been, I don't know, like a month or 2 into 1st grade, and she told us, our daughter told us, well, every day at this time I go to this reading intervention. And we're like, what? You're in a reading intervention? And she's like, yeah, I go with this person. And I was kind of looked at my wife and like, oh, did you know about this? And neither of us had really heard from the school that that she had been pulled out for reading intervention. So we're like, okay, well, the school must know what they're doing. And then so this was first grade, and we had a teacher conference, that was kind of like routine. And at that point, I was starting to learn a little bit enough to be dangerous. And what I mean by that was that, like, that pediatrician mentor that I had the privilege of working with, and the private practice I was in at the time, she had already kind of started me down that road of learning about dyslexia. And I had read the Dyslexic Advantage, and I was starting, just out of my own curiosity, I think, as a pediatrician, was starting to kind of learn these words that as a pediatrician, I'd never heard before. And even as a parent, like phonemic awareness and like phonological memory. And so we're at this first grade teacher conference, and the teacher says, okay, well, she scored, here's her dibbles, and she did okay in this and this, and her phonics, she's in the yellow. And I was like, oh, she's in the yellow in phonics? I said, well, do I need to get her tested? And she's like, oh, no, she'll be fine. And so I was like, okay, she'll be fine. So that was, first grade, and she went through all of first grade, and she was still doing reading intervention the whole time. And then we get into second grade, and she still gets pulled out for reading intervention. And at this point, I should say that my wife and I were never really told what they were doing. And as a parent, like, we weren't given progress monitoring reports of like how she was like progressing. And it got to the point where it was January of her second grade year, and I had this kind of like feeling in my gut that this whole time. I think part of it was because I had seen kids in clinic, and thanks to my mentor there, like, starting to kind of consider that, oh, it wasn't just ADHD, or it wasn't the child was lazy, or that there's something could be going on. And so I got her privately tested, and I think as I mentioned in the article, I mean, not to my surprise, my wife was completely shocked. She was not expecting it. She got diagnosed with dyslexia. And that just, of course, started a new journey for us for how to deal with an identified dyslexic child in the school system. And so I don't know if you want me to keep going, because I could talk about this forever, but
this was a great start. So first of all, I taught first grade. So I understand everything you're talking about. I want to just clear some things up for people who are watching. So DIBELS, for people who would like to know, those are dynamic indicators of basic early literacy skills. That's what it stands for. And interestingly enough, many teachers dibble and do nothing with the dibbling. Yeah. So we have a lot of assessments, and it's supposed to pinpoint exactly where the skill deficits are. So like you said, the teacher said, well, your child is in the yellow. That indicates some risk in phonics. Red would be, at risk. Green means no risk. So if you're seeing yellow, they're probably thinking, not a big deal, wait and see, which is really wait to fail. And you also mentioned something that your child was being pulled out and you didn't know what they were doing. Very typical. Usually parents are given a consent form to sign. I also pulled kids, so I would always give a consent form for parents to sign. That's something that every parent should know, that if your child is being pulled out, that you should be aware. It shouldn't just come from the child. But what's interesting is that this goes on, and I wrote about this in my book, in Failing Students or Failing Schools, that many kids are pulled out and become lifers in these types of programs. I called it like AIS lifers, and that goes for special ed too. The goal really should be that we know where the deficits are, and then we're able to remedy the problem or be on a trajectory for success along the way, especially in the early grades. So this was noticed early on, relatively speaking, early on. There are some kids who don't get pulled at all until they're older. So, your daughter definitely was targeted for intervention, but you see a whole year of first grade, and then she's back in second grade. So when I taught first grade, I always knew that if the mid-year, I always saw by January, most of the kids were off and going with their reading. And then the ones who still had trouble at that point in time seemed to continue unless they were going to get the right help. Unfortunately, at the time, the intervention that was being given was reading recovery. This is when I was teaching first grade. And sure enough, those reading recovery students, which is kind of like the typical interventions with, cueing and so forth, those kids would end up in intervention later on or going to private tutors. So, you said some interesting things. I'd like to go to your article. In the article that you wrote, which I love, that's why I contacted you in the first place, absolutely loved it. It's called it's called A Pediatrician's Role in Dyslexia, Where Theory Meets Practice. And this was what you quoted in your article. The development of reading proficiency in childhood is a public health issue. And I'd like to talk about that. When did you come to that realization? And what did you notice in your child as far as her emotional state?
Oh, absolutely. Great questions. Well, I think that the pieces started to come together for me, as I think in the role of a pediatrician, when I had kind of that aha moment. You talked about that book that you read in your book that was kind of your aha moment that talked about like structured literacy. And for me as a pediatrician, I think it was just listening to the Emily Hanford documentaries about really kind of the state of literacy education in our country, and how that occurred with the reading wars. Because honestly, until I heard those documentaries, I honestly felt like, well, this is the school's deal. It's the school's deal to teach kids to read. It's my deal to basically to doctor children and to hopefully instill healthy habits and of course treat illnesses and disease. But literacy, I did not feel like was my responsibility. And then when I kind of experienced that like eye-opening moment from those documentaries, I realized like, well, no, like literacy is related to to anxiety and to depression. Literacy is related to that school to prison pipeline, and just looking at the economic and societal costs of like poor literacy or functionally illiterate, as you talked about in your book. I realized that, my role as a pediatrician is basically the physical and mental health and success of this child in front of me. And regardless of what I could do in the clinic, as far as trying to throw medicine at their ADHD, or throw antidepressants at their anxiety, if we don't get to this, a lot of times the underlying cause and only treat the symptoms, then I'm not doing my job as a pediatrician.
Yeah, you said that perfectly. And that's kind of the conversation I have with parents, uh, because many of my students over the years have anxiety and or depression. And, we talk about the ADHD because it does overlap with dyslexia. You will see it often. And I'll say, you know what, maybe before you go to medication, why don't we try just working on some of these reading issues? And lo and behold, all of a sudden, I see sometimes, not all the time, of course not, but many times I see a different child in front of me, just sitting up differently, more confident, uh, just nothing like how the child walked in. Like really, it's transformational. But of course, not always. There's always that which came first, the chicken or the egg, right?
Mhm.
So you're not quite sure. But sometimes I'll ask parents, did you see any of this beforehand? Uh, and then they'll say, well, no, it really started in school. And that triggers something for me when I hear that. But that should definitely be a conversation. So, did you ever think that your child would struggle to read? Did you or your wife ever struggle to read?
We have asked ourselves that question a lot. And, as far as like knowing the genetic like inheritance of dyslexia, um, we're not, I mean, neither of us are completely sure. I always maybe just kind of joke that my mom was a speech language pathologist. So, and she did special ed in the school system. So I just feel like, well, if I was the one maybe that had more of like the genetics of dyslexia, maybe she remediated it and I didn't even know, because I remember doing a lot of phonics growing up for sure. So neither my wife and I knew or had reason to suspect that like we would have children with dyslexia. And we have 3 kids, and um, you know our oldest is the one who, like, as parents, we feel like we kind of experiment on our oldest because we're not really sure what we're doing. So she's the one who's definitely taught us all. But our youngest, who's in 1st grade now, who's 7, he also has dyslexia. And I haven't honestly met any family that has more than 2 kids where 2 of them don't have dyslexia, because just the statistics, I think, kind of go in that favor. So so we kind of knew, I think, what to expect, and so our 1st grader didn't go, fortunately, through the trials and tribulations as our 5th grader did with the school and with the intervention, because I think we were wise to it at that point. But yeah, so now, like, we're learning as we go, but we're parents of 2 dyslexic children, trying to make sure that they get the support that they need.
You said something very interesting, how maybe the work you did with your mother could have changed the trajectory for you.
Yeah.
That speaks to early instruction
Yes.
right there. Um, and that's why, even if a child might have a genetic predisposition, a biomarker, imagine if we really knew how to help children. And we do. I'm kind of saying that rhetorically, but we really do know.
Yeah.
This is not a mystery. We know how to help kids. What we would see, and we would certainly see the numbers going way, way, way down, because you can't tell me that all these kids have dyslexia. Everybody has a learning disability, because that's just not so.
Correct. Yeah. And when you I mean, I guess when you engage in the schools with a reading program that's not based on science, I mean, coming from a medical background, we don't typically, do non-evidence-based care. We certainly try not to. And if we know about evidence-based care, that's what we're going to do, because, I mean, kind of a Hippocratic oath, first do no harm. Our goal is to not be harmful for our patients, but to obviously give them the best practice.
So you probably just read my mind, because on my list, I wrote down for myself that one basic medical principle is do no harm, right? And I want to just mention my husband was chief counsel for the New York State Grievance Committee, and presently provides representation to lawyers being investigated or prosecuted for unethical or unprofessional conduct. So why am I bringing this up? There is a panel, an ethics panel in law. There's an ethics panel in medicine. Mm-hmm. Why is there not an ethics panel in education? I would think that this is truly an issue that needs to be explored, right? I mean, do no harm. You're working with children's lives. If that isn't the biggest ethical issue of our time, how in the world could we not have something like that? And the only reason I could think of is that the dirty little secret is that we have people, publishers, universities, where they have a vested interest in keeping these unproven strategies and materials going. What do you think of that? I don't know.
I mean, as I'm definitely learning a lot in this journey, and I have, again, I mean, I've come across that history as well, and yeah, I mean, it does seem to be a perverse reason to continue non-evidence-based curricula, because I think there is a financial interest. There is a financial interest in schools who've invested money in it, and even like speaking locally. I mean, like we live in the second largest district in the state. It's got a lot of schools, a lot of students, and we have something, I don't know if this is national, but we have something that's called local control here in Colorado, where the schools pretty much can decide their own reading curriculum. We don't have a standardized curriculum in the district, and so I think that some teachers kind of like decide to kind of pick and choose what they want, and unfortunately at the great detriment to our children. And it's hard to know who's accountable and who's in charge of like the entire literacy block in our county. And again, I mean, as a like, not just a parent, but as like a medical professional, I mean, that doesn't reconcile with me. Like, we don't do that in medicine. We don't make up treatments like locally. I mean, we always seek to, I mean, I guess to provide our patients with the best practice care. And so, I mean, that's why this whole thing doesn't actually really make sense to me as a pediatrician, that we would abandon something that we know our kids would thrive with because of, I don't know, proprietary or more like kind of financial interests.
Well, there is a literacy expert in our circle. Her name is Dr. Pamela Snow. And she describes it as a choose your own adventure.
Mm,
That, you could kind of do whatever you want the way it is now, choose your own adventure. And that is just absolutely just stunning to me,
yes.
that that happens. And I mean, these ethics panels are created to protect people when there's a conflict of interest. Clearly, when you have um, people who are behind a program paying others to do research uh, for them, they're going to come out in favor of a program with a biased lens. It
Mm.
just doesn't make any sense. Um, I'd like to ask you, as a medical professional, do you think a dyslexia diagnosis is helpful?
Well, I guess maybe speaking from, anecdotally from my personal experience as a parent, and then the patients that I've cared for in clinic who we've been able to acquire evaluations for, not really. And a very savvy and smart speech language pathologist who actually was the one who evaluated my daughter, who is, Orton Gillingham trained and provided literacy, like structured literacy, remediation. She would tell me for my patients, who a lot of them could not afford like most of these evaluations, like I wouldn't have them spend their money on the evaluation. I would have them spend their money on a good tutor. Um, and so I mentioned
I
that.
agree.
Yes.
No,
Well, and that's
no, but
because
honestly, though, and this is, separate, but I've said this before. I could recognize what needs to be done in 20 minutes.
yeah,
I don't need 2 days worth of evaluations to know what I need to do. It really isn't that hard to spot. I've been doing this for years. However, in the school system, what parents tell me is you need this outside evaluation to even start to begin the process to get what you need, the right instruction. But as I read from your article, and what I know is that even once you get the evaluation, there's no guarantee that you're going to get the correct instruction. Correct? I mean,
well, correct. I mean, from personal experience with our old school, the IEP didn't really do anything for us, and so, fortunately, we were blessed with the means to do private tutoring. So even with an IEP, we actually pulled her out of special ed intervention because that was a hodgepodge. It was like 9 kids in the group. It I think that they were using maybe an Orton Gillingham based like format, but we were more confident in the private tutoring, and we didn't want to waste more valuable time waiting to see if what they were doing was going to be effective. So we pulled her out of that, and so I think that in some respects, having the dyslexia diagnosis did prompt the school to take us seriously. But and then hopefully in the future, maybe with like in high school with more standardized testing, like that diagnosis will give her like an allotment of accommodations. But I think this is also a good important point that, and my mentor has really, like, she really focuses on this. And I think it's important to mention, if parents are listening out there, with my daughter's anxiety, we pull her out of every state test that they have. Whether like, in Colorado, I don't know if like the acronyms are the same elsewhere, but like we have CMAS, and we have MAP testing, and we pull her out of all of those because otherwise she is an emotional basket case. And so my mentor, like, she tells families like I wouldn't have them do standardized tests. If that's something that like makes them or gives them anxiety, then they're not worth it. And so just to mention to parents out there that like we do have a lot of control over of some of the stuff that happens at school, and testing is one of them. And so like we've been happy to pull them out just because like I didn't want to put my daughter through that stress.
Yeah, so you actually hit upon something that I wanted to talk about. You know, let's be frank, we are two white professionals,
Yeah.
and we're talking about private evaluations. We're talking about having choices, right?
Yes.
And this is why we are on the Teach My Kid to Read mission. And that's why I am reaching out to you, because we need an advisor like you. And we need to have a diverse group of people reaching out to the Black and Brown communities, because many of the people I speak with do not and cannot afford private evaluations. They cannot afford parent advocates. They cannot afford private tutoring. And so, you know, we have parents listening to this Facebook now, and this is a real privileged conversation we're having, Doctor, quite honestly. And you work in community pediatrics with low-income Medicaid patients and non-English speaking people as well. So I guess my question is, what would they do? What would your patients do?
Well, you're right. I mean, and that's I think what prompted me to write the article is because we have, I mean, fortunately, there's a little bit more of a lens looking at the importance of pediatricians and viewing literacy as a developmental domain. And these articles are coming out and being published in Pediatrics about how we're supposed to do all these things as pediatricians, but that hasn't been my experience. That I mean, that is it's an easy road. It's not, because what these articles don't speak to is well, yeah, you can try to identify somebody, but then that child is still going to that school that's failing them, and you know, I could, even if I got somehow through grant funding got a private evaluation, the parents can't afford to do private tutoring. So the child is stuck in this school that is doing potentially like the wrong intervention, or not implementing the intervention correctly. And so I mean, it's difficult, and it's difficult to navigate and try to help this family advocate when also you're dealing with levels of sophistication. And if I'm, you know, if I have a patient whose parents only speak Spanish, you know, they may not have the understanding necessarily of how to navigate the school, and you know, there's added complexity of like, if Spanish is the first primary language of the child, then I think that there's the feeling that that this isn't dyslexia or a reading disability, that this is just their you know, English is a second language I guess journey. So I mean, there's no easy answer. I try to you know, get them like evaluated in ways that, like, if they're on Medicaid will pay for, but then that leaves me with nothing to do as far as remediation.
Well, that leads to my next point. So you keep anticipating everything I'm going to ask, but one of my points here is, So we know that early identification is crucial, but if we don't change instruction or intervention, aren't we putting the cart before the horse?
Well, yes, I think so.
Mhm.
I mean, if we don't, from kindergarten, starting kindergarten, first grade, if we don't start with structured literacy, um, then we are creating all of those way to fail effects, and the stuff that always come across in the reading, like the Matthews effect, and just the access to words and vocabulary, and and I think and it just comes to mind now, and I think as a parent and even as a pediatrician, like we've had the focus in the wrong area. As we've been a proud participant in Reach Out and Read, and to look at that is such a simplistic view that kids who can't read is only because parents didn't read to them.
Mhm.
And that is, I think, and not to I don't want to have like any kind of like negative like impressions of Reach Out and Read. It's a wonderful program, getting books in the hands of families, especially a lot of families where that might not be their culture at home, is to read. um, but just taking it simply to the simple view of reading, when we look at that reading comprehension being the product of decoding and your basically your vocabulary, your language comprehension. Sure, vocabulary and access to books is important, but if we don't change that focus to like phonics and kind of explicit instruction, um, it doesn't matter how many books I give out to these kids, they're not going to learn to read.
Well, that's why I'm so proud to be involved with Teach My Kid to Read, because uh, we're not going to wait for the schools to decide to change. You read my book. I've been involved in this for many years now. I was involved with Reading First. This has been over 20 years of waiting, having the information, the science was there. It's been very clear what everyone should be doing. So now it's time to really bring this information to the community. And our whole goal is a backdoor approach, that if we involve parents, pediatricians, librarians,
Mhm.
preschool teachers, daycare workers, local barber shops, churches, community members have to know what reading instruction looks like so that they could then push for something better in the schools. I think schools have gotten away with this far too long because they were able to do whatever they wanted. People just trusted, like you mentioned. There was this trust, and why wouldn't you? They're the professionals. The same way you're a doctor. You know what you have to do. You expected the schools to do right by you. You moved to an area that had highly rated schools. Why would you think that you wouldn't get the right help for your child? But that's why I think we need to bring other people into this conversation. And our whole goal is a backdoor approach and trying to really help people who can't afford this type of help outside the schools. So, I'm so happy that we are connecting. And I really only have a couple of more points. I don't want to keep you, and it's really my honor to have you here. And everybody, I'm sure, is thrilled. I think, my next question really is about screening. And so, there's a lot of talk about screeners right now, and we have people working with us and talking to us about screeners. But, you know, we could get these screeners in, and wouldn't we have a lot of children early on being screened for potential difficulties where parents might just wonder, okay, now what do I do? Where do I go? What do I do? And they're still not going to get satisfied or satisfaction in the school. So is that the best approach now? Or should we be working on getting tier one instruction right so that people understand what good instruction looks like and then get the right screeners? I'm just asking
Yeah.
you your opinion with that.
Well, yeah, and I think that, and I have a lot to learn about screeners, and I think that, I know that some I think are being worked on and validated, but screeners always have problems with sensitivity and specificity, and are you picking up just late to mature readers? And I think in some ways screeners hopefully just kind of start a conversation with parents and well, I guess mainly with parents and maybe parents with the schools. But to use an example of, what I think would be the best approach, where screeners probably aren't as, maybe not as vital, is the charter school that we moved our children to. That the reason why we moved them to this charter school was because, well, one, I've already told my story about kind of the failed model in our prior school, and how that was not working for our daughter. But the charter school we went to, all like the first three grades, K, first, second, and third. So the first four grades, K through 3. Every teacher was Yoshimoto OG trained, and because that principal took it upon herself, who also has dyslexic children, to have the person who has the most touches on that child, not a special ed teacher, but the child's teacher, to be trained in structured literacy. And the school system that we put them in also had a Colorado Department of Education approved kind of science of reading curriculum. So that's where they start, they went to, and our youngest was in kindergarten, and early on, and this was before we were able to get him diagnosed with dyslexia, he got identified with some difficulties with blending his sounds together. And so they put him in an extra reading group, but he was also already getting OG throughout his literacy block. So in that sense, a screener, to me, I don't know, maybe doesn't make as much, it's not as important. And maybe those screeners or, monitoring tools, are more useful for seeing the progress. But we were actually, for the first time in our parenting career, we were actually reassured that the school was doing what they were supposed to be doing with our kindergartner. And so, yeah, so I think that, what is the effect of a screener if you don't have a treatment for it? And so, keep working on the screeners so we can start the conversation about these kids. But ideally, every K through 3 teacher is going to be trained in OG. That would be my ideal.
And I agree, completely agree with you. This is also why I wrote the If Only I Would Have Known series, because, as you know, that's what I would hear all the time from parents. If only, right? If only I had known then what I know now, I could have been an advocate for my child. But, I really feel that the point of me writing that book was to open the dialogue, start the conversation. We need to have discourse. And so it's an easy way for a pediatrician and a parent to kind of look at a family and, kind of say, oh, is that my child? Is that something I'm seeing? Because that to me is really what counts, is just starting the dialogue, starting the questions, starting them to understand, ooh, these are the touch points that are important, and not to be led astray by, oh, wait and see, just give it time. No, if I'm seeing more than 2 or 3 markers here, I really better start paying attention and asking questions and finding out a little bit more. And I think that whole questionnaire idea is very important, because that's from the family, right? What they're seeing. And if there's enough on that list, maybe just you talking to them, because that, I know I trusted my pediatrician. That's the first person a mom goes to when there's a problem. So, if I had a young child, I would be going to you saying, hey, does this make sense? What should I be doing now? Not that you should be doing the testing, the big testing or interpreting data. I don't think that's the job of a pediatrician. You don't have time, and that's really not your focus. But it is that way of starting the conversation that would be extremely helpful for parents.
Yeah, I totally agree. And I think it's a dual responsibility. Like, I think parents should be encouraged to go to their pediatrician to talk about literacy concerns. And I mean, before I kind of went down this journey and learned just from the experiences with our daughter, I probably didn't probe as much, because I could tell you that, I mean, there is, I would say probably the majority of the time, if I ask a child and their parent in my clinic how school is going, I get fine. The answer is fine or good. And then when you say, I mean, when you start to probe, like, how are they reading? Then you go, oh, well, he has an IEP. And you're like, oh, he has an IEP, huh? So what is the IEP for? So there is a surface level that parents give you if you just stay there, if you're just like, okay, fine, and you write down fine, then you don't get to deeper levels of really what's going on with that child. Because and this is just my assumption, I don't think parents see me as somebody who could be involved in, I guess, in helping that child with literacy. And there's probably a lot of pediatricians out there still who don't feel like that's their role. But we've been talking this whole time about like why it's my role, and it's it's that partnership with the parent.
Yes.
And pediatricians do wield a lot of influence, and plus we're poised in the position to really help a family potentially navigate evaluation. So the plug for parents is feel free to be more, like, I guess, in depth and detailed during your child's well-child exams. But for pediatricians out there, sometimes you're gonna just need to probe, and you need to specifically ask, how is the child reading? Are they reading at grade level? And sometimes you will be surprised what you learn.
Yeah, just like a parent, right? How's everything? Fine.
Yes.
You'll get that answer when they're teenagers. Just wait.
Exactly.
Never ask them. You have to specifically ask them 3 things that they learned in school that day.
That is very true.
They'll just get fined.
Fine.
Anyhow, Doctor, thank you so much. This was just a wonderful, wonderful conversation. I so appreciate you coming on here with me. And I hope that we continue talking about this, and we're so grateful to have you with us.
Thank you. Again, the honor was mine. Thank you.
Thank you. Okay, good night.
Good night.